All right, good afternoon, evening, morning, wherever you are today. Thank you for joining us for the Thrive with Lyme Summit. I'm Elizabeth Elliott with Fusion Stretch and Wellness in Louisville, Kentucky. And today I am excited to have Dr. Nicola Ducharme joining us for all that she has to share. So, Dr. Nicola, thank you so much for joining us. I want to share a little bit about you with our audience today, okay? Nicola Ducharme, naturopathic doctor, is a licensed naturopathic doctor and is the founder and medical director of Restore Medicine. She is recognized as a Lyme expert internationally. She has authored several books on the subject, including The Lyme Diet, The Beginner's Guide to Lyme Disease in Australia, and Lyme Brain. She has also been a chapter contributor in 2 of Connie Strassheim's books, Insight into Lyme Disease Treatment. 13 Lyme literate healthcare practitioners share their healing strategies and new paradigms in Lyme disease treatment. 10 top doctors reveal healing strategies that work. Dr. Nicola has developed 2 online training programs for Lyme disease, Lyme Ed for patients and Lyme Ed for practitioners. She consults with patients around the world, blending conventional and integrative approaches to treating Lyme and other tick-borne illnesses. Welcome, welcome, welcome. Thank you so much.
Thanks, it's great to be here.
You know, what brought me to learning about Lyme disease is in April 2021, my daughter got a tick bite and her head began to swell, the back of her neck, some lymph nodes, and up into her scalp. And I kind of wrote it off. I mean, not for long, because she leans towards anxiety and she wanted me to take her. Mom, I saw a TikTok video. You have to take me. And so I did. I took her within the week and we got a positive, you know, however long it takes to get those results back. And they put her on an antibiotic. They only did 7 days. And so then later she's like, Mom, doctor so-and-so didn't give me 30 days. I read 30 days. And so we went back to her pediatrician with whom at that time we tested again for 10 bands. Now this is the traditional test. That's the only one we have done. And it was still positive, and they did not think, and I maybe, you know, it came back as having had it. It might have been a past infection. I can't remember. This was in August of 2021. So at April and then August of 2021. But as soon as we found in April, we started with diet. I was like, we got to go on we've got to change your diet. Like my daughter Madeline started reading all kinds of information about changing the diet. And that's always been a big thing for me and my family, is the food. But I know that there's a whole lot more to treating Lyme disease than just that. So besides diet, what else? I mean, you've written all these books. What else do you want to share with the audience on how they could best, like in her case, they get the tick bite, they have a positive. What's next?
Well, the first thing I'd say is to go a step backwards, and that if at all possible, if you're bitten by a tick, save the tick.
Oh, yeah, right.
Because you can send the tick into a lab and see which infections it carries. And so that can be a really, really helpful thing for identifying between, Lyme disease by definition is Borrelia burgdorferi, but there are other pathogens that can get transmitted through a tick bite, such as Babesia and Bartonella and Ehrlichia and Rickettsia. And I mean, there's a few of them. So the first step is, if you can identify which pathogens the tick is holding on to, then it guides treatment so much better. The second thing I would say is, the standards of care for acute Lyme are directed by the Infectious Disease Society of America. And according to their standards of care, all Lyme is eradicated with, basically from 14 to 21 to 28 days of antibiotics. Anything beyond that, in their opinion, is categorically not caused by the infection itself. And this is really misleading, because people go and get like a short course of antibiotics and maybe still feeling unwell, but there's no recognition that the infection could have persisted and the antibiotics didn't do their job. And yet that's what I see happen time and time again. So it's really hard. And then with the testing, the criteria for testing is so much more strict and stringent through what we call the CDC criteria, the Centers for Disease Control. So it's really like, my encouragement would be, if anyone is, especially in the early days, those acute phases of Lyme, where getting aggressive enough treatment can make the difference between it becoming chronic or not.
Okay.
My encouragement would be for people to seek out a Lyme literate doctor through an organization such as ILADS, which is the International Lyme and Associated Disease Society, and get more aggressive treatment than the 7 days or 14 days of doxycycline, because often that just doesn't cut it. So that's the first step. Your point of changing the diet and reducing inflammation in the body is definitely important. For me, when I treat, the majority of people I treat with Lyme are chronic. I'm in San Diego. I have treated acute cases in San Diego. There is Lyme here, but just not as much as other parts of the country. But we have a lot of people that get bitten elsewhere and are living in San Diego or moved to San Diego. So I work mostly with chronic Lyme. And I would say the majority of the time I'm using integrative approaches. So that means combining antibiotic therapy with naturopathic support. And so, there are some docs that do all antibiotics and don't recognize like the natural side of things that can be so helpful to the body. There's some more naturally oriented practitioners that go, oh, antibiotics are so horrible for you, and they'll make it worse, and they'll make you immune, resistant, and all of these things. And I think neither of those are necessarily the best way. Like I do have the majority of my patients on antibiotics at some point.
Mm-hmm.
Some don't, if they're hypersensitive or have massive gut issues, or if it's just like philosophically not what they want to do. But I find the best approach is a combination of medication and then using naturopathic support to help keep the gut in balance, to help keep the liver happy, to help detoxify the toxins that are kicked up when we start killing off the pathogens, which is something called a Herxheimer reaction. And so, yes, diet is a part of it, but there's so many tools we have, ranging from pharmaceutical options to natural options, herbal medicines, homeopathics,
Mm-hmm.
nutrient supplementation, that can really kind of put it together and give the best shot at getting over it.
Okay. So when you talk about finding that lab to send the tick to, because we didn't do that, but I have learned that since.
Yeah, it's not something you think about in the moment. Like you've got to be prepared for it. I was up in Morro Bay, which is Central California coast. This is like 4 years ago.
Mm-hmm.
And my daughter was playing in the playground, and I just tied her hair in a ponytail. She went off to play. She came back 5 minutes later, and I saw a tick on her neck. And knowing everything I know, I still instinctively picked it up and threw it away.
Right. So you would almost send any tick.
If I could, yes.
Yeah. And where do you send it?
Pennsylvania, there's a good lab in Pennsylvania that tests it. I'm trying to remember the website off the top of my head. We can find that later, but it's either ticktest.com or ticklab.com.
Okay.
Yeah.
And so you send them the tick. I actually, during this summit, found a tick on my dog that had gotten pretty large. And a friend of mine just lost a dog to Lyme disease. It's just, yeah. I mean, it's just, I felt like I had just a drop in the bucket of knowledge, and am just learning all of this stuff about Lyme, since the diagnosis of my daughter. So why is it that so many people have a hard time, or you read these stories where they've been undiagnosed, these crazy, why does it take so long? Where's the
missing link?
Yeah.
So it comes back to the Infectious Disease Society of America. So I referenced that already, and that's really the problem here, because the IDSA, the Infectious Disease Society of America, does not recognize chronic Lyme. Mm-hmm. And so doctors going through the regular allopathic medical training programs are taught that there's no such thing as chronic Lyme, and that Lyme, even, it's only in the Northeast. Mm-hmm. And you have to have the bullseye rash to make it Lyme. And if you give 14 days of antibiotics with doxycycline, they'll be cured forever. Mm-hmm. That's what doctors are trained with. That's the information they're trained with. And so when people present at a doctor's office, Lyme is not on their list of things they're looking for. Mm-hmm. They're programmed to think that there's no such thing as chronic Lyme. So if someone has been unwell for 10, 15 years, it couldn't possibly be Lyme.
Right.
And then the problem is they go into the standard testing, which again, it was never meant to be used as diagnostic testing. It was meant to be used as surveillance criteria, which means more for like epidemiology, like looking at case counts and things like that.
Mm-hmm.
And that is what is recognized by the CDC as a positive lab result or a negative lab result. And it's a very, very strict criteria. And it's not clinically broad enough to catch these cases.
Mm-hmm.
So people are either having a test and getting a negative result because the test is rubbish, or I've heard this many times, they get a positive result and their doctor says, it's a false positive. There's no Lyme, you don't have Lyme. And so they walk off and spend the next 10 years of their life miserable, not finding any answers because all the other testing, the MRIs and the blood tests and this and that and the other come back negative. Cardiologist says your heart's fine. Rheumatologist says your joints are fine. Neurologist says your MRI was clear. Endocrinologist says, no, your hormones are all imbalanced. And these, but the human being in front of them is like, that is so not true. Like there is something desperately wrong, but they're not looking for Lyme. And if anything, they're trying to deny the existence of Lyme, even when there is evidence, like even when there's a positive test.
So when you say the test is rubbish, what test do you recommend?
Yeah, good question. So look, there is no Lyme test that's 100% reliable, 100% sensitive. But the lab I use is IGeneX. They're a specialty Lyme lab out of Northern California. Lyme testing is what they do. That's what they specialize in. That's what they're working to, maximize the effectiveness of their tests. And granted, yes, those labs are out of pocket and they're not inexpensive. But compared to the time and money people are spending not being, accurately diagnosed,
right?
In my view, it's worth it. So that's the testing that I recommend is IGeneX. And they will actually report their results. They'll say if it's positive or negative according to their criteria. And then they'll say if it's positive or negative according to the CDC criteria.
Okay.
So they will make that distinction. But they have a much broader parameters of the bands, the antibody levels, all the bits and pieces that they think is clinically significant to indicate Lyme disease.
Okay. So I have heard of that lab now, and I actually have that at home we just never sent it off. It appears as though that particular, you have to have a doctor draw that lab, right? That you have to have somebody.
You have to have a doctor order the test. Yes.
Okay. Yeah.
The doctor has to order it. And then there's a variety of labs around that will do the blood draw for it.
Okay. So the audience needs to know that would be, in your opinion, one of the more accurate tests. And
correct.
Would they need a Lyme literate medical doctor to request that? Or
look, any doctor can.
Okay.
It's a question of who's going to interpret the results.
Okay.
Right. So any doctor can order the kit, but you want a Lyme literate doctor to be interpreting the results and telling you this is what it means and this is what it says and this is what we need to do next. Because the other thing I want to point out, and I mentioned it a little bit earlier, but just to reinforce, that Lyme disease by definition is the infection with a bacteria called Borrelia burgdorferi.
Right.
But there's all these other co-infections. So even if you did like a LabCorp or a Quest or one of the, the more narrow criteria tests and got a positive, then you're one of the lucky ones who actually got it identified. And then has a doctor that's like, okay, I recognize that as a positive, let's do something about it. But then if you don't test for co-infections, there's a whole slew of bugs that could be causing problems that you're not treating.
Okay, so when you say co-infections, is that equivalent to or comparable to the word bands?
No. So bands are part of what's reported on a lab test called a Western blot or an immunoblot. Bands refer to a certain part of the pathogen that they're measuring an immune response to.
Okay.
Co-infections are bacteria, protozoa, other pathogens that can be transmitted through the same tick bite.
Okay.
Or now we would expand it to say mosquito bite or flea bite or
right.
Realizing there's a wider range of vectors now.
Right. And now I also read that Lyme could potentially be transmitted from mother to baby?
Correct.
And
Correct. And it
is that
can potentially be sexually transmitted as well.
okay?
So
Now,
we
is that whether it's a current infection or, like, I don't want to say, like when we had our most recent test, it was an IgG and an IgM, right? She said, so we can recognize we've had a past infection.
So is IgG positive but IgM negative?
Correct.
Okay.
If someone has is that something that she could pass on? Like,
It would depend if she was
this
still
will be able
symptomatic. I
to
mean, when
pass on
people
to-
are treated acutely,
Mhm.
if people are adequately treated early on and they really do not knock it out, then Lyme can be cured. We can say that in acute Lyme with sufficient treatment, it can be like dealt with. Once Lyme becomes chronic,
Mhm.
then that's when we start to raise these questions about, because then at that point, it's not really, we don't cure it. We don't get rid of it entirely. We just
Right.
knock it down so the immune system can cope with it
Right.
and sort of live in harmony with it.
Right. So then when like other viruses may, like Epstein-Barr,
Mhm.
I mean, they can kind of, I mean, that's going to, give add to the body's viral load, right? So then the body is dealing with, it just seems like the immune system would be.
Yeah, I mean, the immune system is, and the other thing is that Borrelia, the bacteria that causes Lyme, is immune suppressive. So we're looking at a bacteria that actually lowers immune strength over time.
Okay. So indeed, it could be potentially passed sexually.
I have seen that too. Yeah. And so, I mean, I've got tons of patients whose partners have not become unwell when they are unwell, the majority.
Right.
But I have seen direct cases where, somebody like a human being was well and healthy and fit and was intimate with a person that was not well and had multiple symptoms and ended up with the exact same symptom picture.
Okay. So the first thing you would do is save the tick.
If you can save the tick, save the tick. Send it into the lab, see what it's carrying.
Mhm.
Because the other thing is that, when you first are bitten, your antibodies aren't going to measure for the first bit. So when you're first bitten, you want to get on those antibiotics before you're likely to have a test result showing a positive.
Okay.
Right?
So even if they come back and you've had that tick bite, you may want to take the antibiotics.
Yes, depending on how long the tick was going to take. So I had a patient once who made an new patient appointment with me for her daughter.
Mhm.
She had been bitten in Central California and they'd sent the tick to the lab. But she was freaking out, wanted to get her started on treatment. So she brought her into me. And ironically, she was walking through my door into the waiting room and she got the results on her phone saying the tick tested negative. So she was like, oh my gosh, so happy. But she's like, oh, sorry.
Right.
But in that case, I would have started her on antibiotics pending.
Okay. Waiting
Yeah.
for
Waiting for that test.
Then, as you said, I know a lot of people are concerned with the antibiotics and then the gut microbiome.
Mhm.
How do you navigate and treat patients when when we are taking heavy doses of antibiotics? I mean, that's something that I think about.
Yeah. Yeah.
How do you
Well, that is one of the downsides of antibiotics. That's one of the, it's one of the issues and the side effects to deal with. The first step, well, there's a number of different things. The first step is just really high potency, high quality probiotics. I'm having people do between 100 billion and 200 billion units per day, CFUs per day.
Mhm.
Separated from anything antimicrobial, meaning whether it be an antibiotic or an antimicrobial herb, and probiotics separated by 2 hours.
Okay.
Then the diet plays a big role. Like you can't be on antibiotics and be eating sugar all day long. Like that just doesn't work. And a lot of people even have to limit their fruit intake for a while or just avoid the really sweet fruits like grapes and bananas and mangoes and things like that.
Okay.
Sometimes we even do an antifungal medication. There's one called nystatin that helps to prevent yeast overgrowth in the gut.
Okay.
It's very safe. It's very non-toxic. It doesn't go to the liver to be detoxed. And so sometimes we'll do that as a prophylactic or some kind of herbal antifungal blend along with the antibiotics.
Okay. Now, do you find that infrared sauna treatments are beneficial for folks with Lyme disease?
Yeah, much of the time, yes, because they support the detoxification. So detox is a huge part of Lyme treatment. And also there's this whole other area about, Lyme people. This is chronic. This is not just someone who gets bitten last week, but, people who've been chronically unwell for years, and they've been running around with a diagnosis of like fibromyalgia or chronic fatigue syndrome or something that's really not what it was. Toxicity can be a big issue. And a lot of people are affected by mold toxins and heavy metal toxicity and all these other things. So again, to be really comprehensive, you want to be kind of looking at these different issues as well. But infrared sauna is really good for the detox. Some people have a trouble with the heat, heat tolerance, people with mast cell activation and high histamines sometimes don't tolerate the heat well. But as a general thing, I think I'm a fan of infrared.
Okay. And you just said something that I wanted to touch on. What about ice? What about the cold therapy? All these ice plunges you see.
Oh God. I have a couple of patients that swear by it. It just makes me cringe every time I think about it. Not for any medical standpoint. I mean, all the cold plunge and things, very good for the circulation, very good for the, reducing inflammation, especially. So I think there's something to that, but I think most people would rather get in a nice warm sauna than an ice bath.
So what other diagnostic testing? I know you said, do you tend to do stool testing or, oh, there was one other one that just popped in my head. I can't think. Sometimes I have the brain fog. What other, I know you said, what other diagnostic testing do you?
Yeah, so often I'll try and get urine mycotoxin testing just to see if there's any mold toxins in the person's body. I will tend to do sometimes testing for heavy metals, which I do through a urine test as well.
And then do you have them have a mold test done in their home?
If they come up positive for mold themselves, then yes, absolutely. That's the first thing that we have them do. And then, I test for all the things that can get off kilter with Lyme, like thyroid function, hormones, vitamin D, iron, ferritin, all of those kinds of things. I do, if somebody has gut issues, I will sometimes do a stool test and assess what's going on there, or I'll do an IgG food sensitivity test. Look at what food intolerance. Gluten intolerance is often a big thing, and that's more of an autoimmune issue. Over and above just the standard food intolerances. So I try and get my folks off gluten as much as possible.
And dairy? I know
cow dairy is more problematic. So definitely limiting the cow dairy, if not taking it out altogether. I find most people can, and some people need to be gluten-free and dairy-free and pull that off just fine. For most people, they can cope with either one or the other, but both is really, really hard.
It's too much.
But yeah, and then avoiding sugar and then eating lots of, lean proteins and veggies and healthy fats and all of that.
Right. And the nightshades, do you recommend, this sort of elimination, or you just kind of
across the board, not automatically. Like if for some time, some people will do a trial of avoiding nightshades. There's so many different diet rabbit holes you can go down, like nightshades and oxalates and all the different things. So I try not to overcomplicate it for people. Low histamine diet. There's so many different possibilities. So I try and individualize it to the person, but also kind of try to simplify it as much as possible.
Okay.
Otherwise, it's very overwhelming.
Right. Oh, I'm sure. Just going to that anti-inflammatory diet for 30 days was a lot.
Yeah.
We're clean, but with her anxiety, and I don't know, she's had that anyway, right? But it seems that could be part of an issue with, a symptom that many with Lyme may have.
Correct. Anxiety and depression are symptoms just as real as joint pain. And some of the Lyme can also trigger like even OCD kind of symptoms, panic attacks. Like there's a lot of different psych symptoms that it can trigger.
Yeah, and see, those were the things that I really was completely unaware of. And again, having just mostly focused on the food and being 17 and wanting to be out with friends.
Yep.
Knowing that no one should be eating flaming Cheetos or Takis. Doesn't matter who they are, which friend. I'm like, but you definitely don't need to be eating it with Lyme disease, right?
Well, yes. Theoretically, yes. And you've got a 17-year-old girl who you want to have some kind of normalcy in her life.
Right.
So it's a question of finding the balance.
So I know you also, I know we could probably talk for a lot longer, but I know you mentioned something about mindset. I know that's a huge part of it's integral for healing, right?
It is.
If we don't believe it, we cannot achieve it, I believe. And so,
Right.
I know that's something that you are passionate
Yeah,
about.
I've really done a deep dive into that. I mean, I've always known that sort of just general, like mindset in general is important. But last year I got trained in NLP therapy and hypnotherapy and emotional freedom techniques and some of these other things. And so I've learned a lot about like how the conscious mind works, how the subconscious mind works, and how we can like program each level for healing. So it's not, I mean, it's very much about like choosing your thoughts very consciously, but it's also about like addressing the limiting beliefs, the values, that the identity of who you are on a deeper level to affect real change. So it's more than just like, oh, I'm going to think fuzzy warm thoughts today. It's actually there's layers that you can go deeper than that. But one of the things that I see, you know, and the deepest level that I look at is a level of identity, right? It's like what you put after I am is really who you consider yourself to be in the world, or I am not.
Mm-hmm.
And so I try and encourage my Lyme folks to not be like, I am a Lyme sufferer. I am chronically unwell. I am never going to get well. I am, you know, because it's all the I ams that they're telling themselves, and their subconscious mind is hearing all of this. You know, it's privy to all of these thoughts.
Mm-hmm.
And so you're basically programming your brain then and firing the neural connections of doom and gloom and hopelessness, right?
Over
Over and over and over again, which makes the neural connections get stronger.
Right, right.
So we need to like stop feeding those neural pathways and start feeding ones that are more empowering. And at first, that little neural pathway is going to be like a little dirt track that one person can navigate. But as you practice and practice, it strengthens and it grows and it grows. And then you've got a single lane road, and then you've got a two-lane highway, and then you've got a 5-lane, you know, super highway.
Right.
But it's the individual's choice. That's not going to happen automatically. They have to like work to make it happen and practice it consciously.
Right. And so you help teach them.
Yeah. So, I mean, I do address
Yeah,
those things in my private practice. And I also have, like, I have coaching programs that help people with specifically this area, because it is so huge.
Well, we only have just a couple minutes. So are there things that you want to share? Where can the audience find you?
Yeah.
And any other offerings you might want to share? I know that you have, is it the Lyme Ed for both patients and practitioners?
Yeah, so I there's a number of different things. So I do work with patients one-on-one around the country and around the world by telemedicine. So my practice is www.restoremedicine.com, and there's no E on the end of restore. It's RESTOR medicine.com. Confusing. They seemed like a good idea at the time. And then, yeah, you can find me on social, Restore Medicine, on Facebook and Instagram, or Dr. Nicola Ducharme, Dr. Nicola Ducharme on Facebook, Instagram, and TikTok. Okay. Yeah, I do have a Lyme Ed for patients, which is an online course educating patients about Lyme disease. Everything from the diagnosis, the symptom picture, the treatments, the antibiotic treatments, the natural treatments, the hormone balance, the digestion, all of the things. And then, like I said, I have coaching programs now that is more about like the rewiring of the circuitry. So probably the best place to go is Instagram or Facebook, and then you can find some of those things there. And then I would like to offer listeners, I've created a mini course. It's called The Down and Dirty Truths About Chronic Lyme Disease. And that's where I talk about some of the things that people aren't talking about, like why aren't we getting diagnosed, and what's going on, and why are infectious disease docs not treating chronic infection, and like all the nitty gritty.
Yeah, it's a shame. And in watching The Monster Inside Me, just the fact that it is not considered a chronic illness, right? So many of these people are going without treatment because insurance is not covering some of the things that they need.
For sure. Yes.
Yeah. Well, thank you so much, Dr. Nicola.
Yeah, you're welcome.
You can find her on Instagram, Restore Medicine, RESTOR. You're going to leave off the E there. And that's medicine.com. And then you said Dr. Nicole Ducharme.
Yeah, Dr. Nicola Ducharme.
On Instagram and Facebook.
Yes.
Right. Okay.
And then the websites accordingly, Restore Medicine website and drnicoladucharme.com.
Okay. Oh, both of them.
Yep.
Okay, awesome. That's great.
And I have tons of information on my website. I love to educate. So there'll be lots and lots of education and resources that people will find there.
Okay, awesome. Great. Thank you so much for joining me today. It was a pleasure to have you.
You're welcome. Pleasure to be here. Thanks so. Okay.